We're tackling a topic that, well, it comes up a lot, but there's often confusion around it. Labor induction.
Mm-hmm.
We've looked through quite a bit of information, and today our aim is really to unpack it, what it is, why it happens, and just get a clearer picture.
Yeah, and it's important, I think, because, while spontaneous labor is often the ideal, induction is sometimes the safest route. Really understanding the why and how can make a big difference for people.
Absolutely. Okay, so let's dive right in. Based on what we've seen, what is labor induction, fundamentally?
Fundamentally, it's described as when your doctor or midwife, your provider, deliberately starts your labor instead of, waiting for it to begin on its own.
Right, not just waiting around. And it's not just decided lightly, I assume. What are the main reasons giving for why a provider would actually recommend this?
No, it's definitely not decided lightly.
Yeah.
The core reason we see over and over is managing risk.
Risk, okay.
Yeah, risk to the health of the pregnant person or risk to the baby's health. It also comes up if someone goes quite a bit past their due date, or maybe if labor starts but then sort of stalls out.
Stalls out, right. Lack of progress. So can you give us some of those specific reasons? The lists seem pretty diverse.
It is quite varied, yeah. One big one mentioned is going 2 weeks or more past the due date.
Okay.
Specifically after 41 weeks, there's this concern the placenta might not work quite as well.
Which is crucial, obviously.
Absolutely, for oxygen, nutrients, everything. Another reason is if your water breaks, but contractions don't start up.
Ah, okay, so the signal's there, but the follow-through isn't happening naturally.
Exactly. Then there are existing health conditions. Things like gestational diabetes, high blood pressure, maybe preeclampsia. Those are often key factors.
Right. Those make sense as serious concerns. What else? What about things focus more on the baby?
Yeah, definitely. So if the baby stops growing at the expected rate, that's a reason. Or if there's too little amniotic fluid.
Okay.
Also, uterine infection, chorioamnionitis, and interestingly, even a history of really, really fast past labors.
Fast labors. Why is that a reason?
Precipitous labor, they call it. The thinking might be to ensure the birth happens in a controlled hospital setting this time, rather than, unexpectedly quickly somewhere else.
Huh, that's interesting. Never thought of that.
And then, like we mentioned, if labor has started, maybe you're partly dilated or effaced, but it just isn't progressing anymore. Induction can help get things moving again.
Okay, hearing that full list, it really hammers home that this isn't about convenience. It's rooted in very specific health and safety concerns.
Exactly that. It's about the provider weighing the situation and deciding that, in this specific case, the risks of continuing the pregnancy or waiting longer are actually higher than the risks of starting labor medically.
A calculated medical decision.
Precisely.
So who are the people most likely to have induction recommended? And when does this typically happen during the pregnancy?
Well, the information points towards individuals who have certain medical conditions, either pre-existing or ones that develop during pregnancy, or maybe someone with a difficult history in past pregnancies like stillbirth or other complications. Induction might lower risks for them.
Okay. And the timing?
Timing-wise, the goal is usually to wait until at least 39 weeks. That's considered full term.
Right.
But, and this is important, if there's a significant health concern for the baby or the pregnant person before 39 weeks, then induction might be necessary earlier. It's always a risk-benefit assessment.
That makes complete sense. Okay, let's shift to the how. The info mentions different methods. Is it like a one-size-fits-all approach?
No, not at all. It really depends on the starting point, specifically the condition of the cervix, how ripe it is.
Ripe, meaning?
Meaning how soft, how open or dilated, and how thin or effaced it is. The provider checks this first.
Okay. So if the cervix isn't quite ready, what's the plan then?
Right. If it's still firm, closed, thick, the first step is usually cervical ripening, getting it ready.
And how do they do that?
Well, one method described is stripping the membranes.
Stripping membranes sounds a bit intense.
It can be uncomfortable, yeah. The provider uses a gloved finger to sweep around just inside the cervix, separating the amniotic sac from the uterine wall slightly.
And the point of that is?
To release natural prostaglandins. These are hormone-like substances the body makes that help soften the cervix and can sometimes trigger contractions. It's often a first step, but, it doesn't guarantee labor will start.
Okay, sort of nudging the body's own process. What if that doesn't work or they need something else?
Another approach is using prostaglandins directly. These can be given as a pill to swallow, or sometimes as a vaginal insert, like a small suppository.
Like medication to ripen the cervix.
Exactly. Names like misoprostol or Cytotec and Cervidil are mentioned as common ones. Then there's also a mechanical method using a balloon catheter.
A balloon? How does that work?
They insert a thin tube with a deflated balloon on the end through the cervix. Once it's in place, they inflate the balloon, usually with saline solution. The gentle, steady pressure from the balloon helps the cervix to ripen and open up mechanically.
Huh. Direct physical pressure. Interesting. So, okay, let's say the cervix is now ripe, or maybe it was already a bit open to begin with. What's the next step to actually get contractions going strong?
Right now, the focus shifts to initiating or strengthening contractions. One key method is amniotomy,
Which is?
breaking your water.
Ah, okay, that I heard of.
Yeah. The provider uses a small, thin plastic hook to make a small opening in the amniotic sac. This requires the cervix to be at least a little dilated and effaced already.
Does that hurt?
The procedure itself is described as generally not painful. You might feel a bit of pulling, maybe a pop, and then the warm gush or trickle of fluid.
Okay. And releasing the fluid helps. How?
It can help increase pressure on the cervix from the baby's head and potentially release more prostaglandins, encouraging contractions.
Got it. And what's the other main tool for contractions?
The other major one is oxytocin.
That's common too, isn't it?
Very common. Oxytocin is the natural hormone your body produces to cause contractions. Given through an IV drip to either start contractions if they haven't begun, or to make existing ones stronger and more regular, more effective.
So it sounds like it can be a sequence of steps, maybe starting with ripening, then moving to breaking water, or sometimes a combination.
Exactly. It's tailored. Depends on the starting point and how the body responds along the way.
Okay, so for someone listening, if they are told they need an induction, what should they actually expect? What's the experience like? And, the big question, how long does it usually take?
Yeah, good questions. The experience really varies. It depends heavily on which methods are used, how ripe your cervix was to start, and just how your individual body responds. There's no single script.
Right. And duration, are we talking hours, days?
It can vary hugely.
Yeah.
It's generally not super quick. The information suggests there isn't a strict time limit, but a common goal or benchmark is for most people to reach active labor, which is usually defined around 6 centimeters dilation within about 24 hours of starting the induction process. But it can be shorter or sometimes longer.
Okay, so patience is key.
Definitely.
Now, pain. Is induction automatically more painful than spontaneous labor?
That's a really common concern. What's described is that the pain level depends on a lot of things. Crucially, pain relief options, like an epidural, are very commonly used during inductions and can manage the pain effectively.
So an epidural is a frequent part of the plan?
Pain management is a standard part of the care.
Okay, so the pain is from the strong contractions, but managing it is part of the process. Let's talk benefits versus risks. What are the main upsides highlighted?
The primary benefit, really, is what we discussed earlier, reducing the risk of complications. Complications that might happen if the pregnancy went on longer, or if labor wasn't starting or progressing well on its own. It's about improving the odds of a safe outcome.
Makes sense. And the downsides, what potential risks are mentioned?
There are potential risks, yeah. And they can depend somewhat on the method used, but the idea is that induction is recommended when the benefits are thought to outweigh these risks for that specific person.
Okay, like what kind of risks?
One mentioned is uterine overstimulation. This is mostly linked to medications like Pitocin. It means contractions become too frequent or too strong.
And that's bad because
It could potentially affect the baby's heart rate or stress the umbilical cord. Careful monitoring helps manage this. Infection is also listed as a possibility. And though it's noted as less common, uterine rupture is a potential serious risk.
Okay.
There's also sometimes an association mentioned between induction and a slightly increased chance of needing a cesarean birth, a C-section.
Right, so it's a complex balance. Are there times when induction just isn't the right path at all?
Yes, absolutely. The information makes it clear there are certain medical reasons why induction might not be safe or possible for someone.
And in those cases?
Then other options would be discussed, like maybe an assisted vaginal delivery if possible, or more likely, a planned C-section as the safest way forward.
Got it. What about recovery afterwards? Is it different if you've been induced? And, people always want to know, is there a fastest way to get induced?
Generally, the recovery process after an induced labor is described as being pretty similar to recovery after spontaneous labor. As for the fastest way, well, there's no magic bullet.
Figured. Yeah. It depends so much on the individual. Often, using a combination of methods, maybe like breaking the water, might speed things up compared to just one method alone. But it's really up to the provider to decide the best approach based on the clinical picture and how things are progressing.
Right. And what about all those things you hear about, natural ways to start labor, eating spicy food, walking, things like that?
Ah, yes. The information is quite clear here. Trying to induce labor yourself with actual medications or supplements is specifically called out as unsafe. Don't do that.
Okay, important warning. Pretty much. The strong advice given is, if you're anxious about labor starting, the best and safest thing is always to talk to your doctor or midwife.
Okay. So, pulling this all together, what's the main takeaway here?
I think the core message is that labor induction is a specific medical tool. It's used for clear health and safety reasons based on a provider's assessment of what's best in that moment. It often involves multiple steps, and it's not necessarily quick or easy.
Yeah.
And crucially, if it's recommended for you, asking questions, understanding the why and the how, that's really important. It's okay to need clarification.
That really does clarify things. It's not arbitrary. It's a considered medical response aimed at a safe outcome. Seeing the details of why and how it's done really puts the complexity of childbirth into perspective.
It does. It really highlights how these medical interventions, when they're genuinely needed, play such a vital role in navigating potential challenges and ensuring safety for both the parent and the baby. It's about supporting the natural process when possible, but intervening safely when necessary.
Absolutely. And it leaves us with something interesting to think about, doesn't it? How does really understanding the specifics, the reasons, the methods behind an intervention like labor induction change how we view that whole balance? The balance between letting nature take its course and stepping in with medical care during childbirth. It's a fascinating dynamic.
It really is lots to mull over.
Indeed. Well, thank you so much for joining us for this deep dive today.
My pleasure.